Welcome to part 2 of my guide to being a graduate. So, first thing we're going to talk about is where you should apply, and this is a very personal choice. No one else can tell you where to go. That being said, I'm going to give you a little bit of general advice on that. The first thing to think about is what interests you. If you're interested in ICU, then it's worth knowing that Fiona Stanley is the only hospital that offers ICU as a graduate rotation. If you're interested in paediatrics, you're going to apply for the Children's Hospital. If you're interested in palliative care, you might look at applying for, say, somewhere like Kalamunda or Rockingham. You're going to think about where you live because travel time can get really wearing. So, how are you going to get there? What's going to work for you and where you are? Something that's probably not so much worth thinking about is how many positions a hospital offers. Sometimes people are like, oh, I'm going to apply for Fiona Stanley because they offer the most number of positions, but they also get the most number of applicants. So I would say just apply for where you want to work. Don't go, oh, this place offers this many or this place offers this many. Every hospital will get more applicants than positions that they offer. So just go for where you want to work. Something worth thinking about maybe is your public versus your private, and you're quite fortunate in that you can apply for both public and private. You're looking at generally quite different patient cohorts, although if you're looking at Joondalup or Midland, even though they're run by private companies, they obviously offer a public hospital service. But say, for example, if you're passionate about Indigenous health, you're probably going to see more of those patients within the public system than you are within the private system. Because private hospitals run as businesses, sometimes things like nursing educational opportunities can be cut for budget reasons. Not to say you're not going to get education, that's not always true. It varies between hospital to hospital, but it is something potentially worth thinking about. There is obviously within private health a slightly different, obviously they're focused on patient care, but they also have this interest in the fact they are running and operating a business. That might be something that turns you off. It might be something that doesn't bother you at all. It's just personal preference. If you're interested in perioperative, something I've definitely got feedback from people who've done grad programs in the private versus the public system for theatre, is that sometimes within the private system, because those surgeons very much their time is their money, they can be quite anti having new nurses, new grads working in roles, particularly as their scrub nurse, on account of the fact that someone learning that role takes longer than someone who's experienced in that role. So sometimes there can be less opportunity to learn all of the theatre roles within private than within public. Again, that varies from hospital to hospital, and it certainly shouldn't mean that you go, no, I'm not going to do that. If that's your area of interest, I would say apply for it, but just be aware there might be that difference. Something that might be important to you is a lot of private hospitals will offer incentives to their staff members. So things like you can, if you come into their hospital under your private health insurance, they might offer a no gap for all their staff members. And that might be important for you or your family, depending where you're at. There isn't a right or wrong. It's all nursing, and you're going to learn and grow wherever you work. The most important thing at this stage in your career is to gain experience and start consolidating some of your clinical skills. So preferences, and this is more specific to Grad Connect. Basically, essentially, your first preference is that's all that really matters. It's very, very rare for Grad Connect to go to second or third round, and very few hospitals look at anything other than first preferences because they have so many applicants, they fill up all of their positions. Particularly if you're looking at a tertiary hospital like Fiona Stanley, Charlie's or Royal Perth, they really only ever look at their first preference. So if you're not going to put them down as your first preference, don't put them down at all. Doesn't mean you have to put them down as your first preference. If they're not where you want to work, don't put them down. But if they're not your first preference, don't waste second or third preference on them. So your secondary hospitals, places like your Armidales, your Calamundas, your Bentleys, they're better ones to put as a second or third preference, unless you want them as first preference, in which case put them as first preference. But there is a slightly higher chance that they may possibly go to a second or third round. I would highly recommend that if you can move, consider looking at rural and regional hospitals. They're more likely to go to a second or third round than a metropolitan hospital. And the other advantage of going rural or regional is that there can be a much greater variety of experiences that are available to you. So say, for example, A metropolitan hospital might have a renal ward, and they might have a respiratory ward, and they might have a plastics ward and a medical ward, and lots of things scattered all over the place. A rural regional hospital might say only have a medical ward and a surgical ward, and all specialties go to either the medical or surgical ward. So you're going to see a greater variety of presentations. Also, if you're interested in moving into a more managerial nursing role, like an ANUM or a NUM, there may be greater opportunities to advance more quickly at a rural or regional hospital than there is at a metropolitan hospital. Not always, but it is something that possibly actually might be more available to you in that rural or regional setting. So people always kind of want to know, when am I going to hear back after I put my application in? So kind of as a broad idea, essentially, applications close. Generally, hospitals have a week to look at those applications, and then they start contacting people. I can't speak for all of the hospitals, but definitely something you can do is, when applications are open, you can contact individual hospitals to ask them questions. But from experience, I'd say Charlie's, Royal Perth, Armidale, they will email you about an interview, and they may either email you telling you to contact them to set up a time, or they may email you with a preset date and time. Typically, they'll email within about a week to a week and a half, and they typically send all the emails they're going to send within 1 to 2 days. So if you haven't heard from them within that time frame that you know other people have heard, you probably haven't got an interview. If you're not successful, you won't hear back until after first round offers have gone out, when they will send you an email saying that you've been unsuccessful in first round. Fiona Stanley tends to phone call. Because they phone call, it takes them a much longer time, so they generally call over the course of about 2 weeks. There's no discernible order, it's not alphabetical, it's not based on selection criteria, anything like that. So be prepared with Fiona Stanley that there is a lot longer kind of a will they, won't they, waiting to hear kind of time. Often those phone calls come in the evening, and it's quite important that you do answer all phone calls during this time. The phone call will come from a private number. However, if you do miss a call, they will either call back or they will leave contact details getting you to call them. Something worth noting if you've applied for St John of God is they use their national HR to do their grad recruitment, and it does take a really, really long time. A long time for them to get back to you about interviews, and the whole process is much longer than Grad Connect. Something that comes up a lot as well is, do my scores matter? Not really. That's the long and the short of it. The things that matter are, first of all, your selection criteria. You need to address the selection criteria appropriately in order to get an interview. If you don't, you won't get an interview. Doesn't matter how amazing your scores are, you won't get an interview if you don't address the selection criteria. But the good news is, once you've got an interview, that means you've met all of the requirements that hospital has in order to employ you. The interview is simply about distinguishing yourself from other applicants and allowing the hospital to rate all of the candidates to decide, even though they would happily hire any of them, which ones are their top picks. In this process, Charlie's is the only hospital I know that does ask for scores, and they use those scores to help rank the candidates who they've already decided to hire. So essentially that means when it comes to Charlie's, your score may affect what speciality you end up being placed in, but it won't affect whether or not you get a job. Another thing worth noting is referees, that you need to have at least 2 referees that they can contact. They need to be able to contact them by email, and make sure you check with your referees before using them. Also important to note, if you're applying interstate, there are some interstate hospitals to whom score is actually very important, and they won't look at candidates whose scores are below a certain cutoff. So if you are looking at interstate hospitals, make sure you do research what their requirements are.